I'm Binita Shah. I'm an interventional cardiologist, and I am the Associate Director of Research in the Cardiac Cath Lab at NYU Langone Health. I treat coronary artery disease, patients who present with acute heart attacks or very weak hearts because of acute heart attacks, as well as patients with valvular disease. My practice is constantly evolving based on the data that comes out, based on our own experience, to make sure that we do right by our patients. The team approach is critical to treating my patients. I'm able to offer patients guidance that I can, confidently say, we know this works and this can help you, whether it be dietary changes, lifestyle changes, opening up a blockage, but treating the whole patient based on a lot of data. As you can imagine, a lot of the patients that I see are quite nervous. I try to explain to them as much as possible that I'm looking at risk versus benefit scenario, and we want to keep the patient's wishes in mind and their thoughts on how they want to be living life and what's important to them to be incorporating into my decision process when I'm fixing the arteries. For a long time, we performed coronary procedures or cardiac catheterization procedures through an artery in the groin. And we've learned over time that working through the artery in the wrist or radial artery access is much better for patients in terms of bleeding complications, vascular access complications. And there's certain groups of patients where we've even seen a mortality benefit, particularly the very sick patients. My research focuses on inflammation in heart disease and how to effectively reduce inflammation around the heart, predominantly when you're having a heart attack, but also how reducing that inflammation after you've had a heart attack in the long term could help you live longer. Even though I was drawn initially to the career of helping individual patients, that I did like the aspect of research and clinical research to try to figure out how to take what I learn on an everyday basis and apply that to more patients and to make an impact in more people's lives.